Yeah, I'll share my screen now with you. As I said, any questions in between? I'm happy to take them. So, okay, so this content for this session is, I hope you can see my screen. It's social and community welfare provision. So the first learning objective here, as you can see, because I talked a bit about what's expected from you in the assignment. So it's to understand the factors that influence health. That's your first learning outcome. So, Oriola, if I ask you a question, what do you think are the factors that influence health and welfare? Any idea? Any factors that you can think of that influence health? Do you think if you're wealthy, you could be healthier?
Possibly.
Yes, yeah. So that's a factor. Yes. Do you think if you're educated, you could be healthier?
Possibly.
Okay. So different people have different opinions about that, obviously. So we'll talk about what those factors are according to research. So a bit about the key terminologies. So what is social and community welfare? This is what we are talking about. So we have to have an understanding of what it is. So a social welfare system would offer assistance to individuals and families who are in need. So it's the social welfare system. So they're just not only people, they're families also. And they have such programs built in, such as healthcare assistance. You have certain food stamps that give you food services and unemployed compensation. So if you're employed, that's very good. But if you're unemployed because of any reason, because of disability, because you have children and you can't stay employed, so you get support. So it's a social welfare system. So lesser known parts of a social welfare system would include disaster relief. So when there's a disaster, God forbid, or there's education that you're pursuing and you need assistance for that, it supports in that way also. So when in England, if we talk about England, there's social care is defined as the provision of social work. It's the personal care, protection, or social support services. This is aimed at children or adults who in need or at risk, or adults with needs arising from illness, disability, old age, or poverty. So obviously we have poverty, the different levels of poverty that people live in. There's illnesses, there's disability, there's old age. So in England, there's this social care system that provides these facilities. So it's not open to everyone because it can't be open to everyone. It's not humanly, it's not technically possible, but it is open to people who are in need of these services. And what does social welfare mean in the UK? So social welfare, there's a law, social welfare law. It's a term used in the UK that describes some areas of civil law in which people on low income. So some people who have low incomes compared to the country, they're typically disadvantaged and they're prone to experience comparison of this law. It's called the poverty law. So here it is called the social welfare law. So what are the main objectives of the social welfare? So social welfare aims basically at providing services to the people who are underprivileged, those sections of the population. And they do this by providing them various forms of social insurance against poverty, unemployment, disability, and old age. There's a little video that I would want you to see. Just a minute. So what I will do is that I'm giving you a link to this video. If you can see in your chat, you can always have a look at this video. So it comes with the, because we're running behind in a bit of in time. So you can always have a look at this video. So it's about health that matters. So it's a video from Public Health England. So if we have time, I'll go through it, but otherwise it talks about community-centered health, it's a community-centered approaches. So the center of the focus is the community. And it is basically for the health and well-being of the community. And it is obviously for those who are most vulnerable. So we'll talk about this video. That is also why I'm not focusing on this video too much. So what are community health services? So they cover a wide range of services and provide care for people. This is from the time that they are born to the end of their life. So there are different levels of care that you provide. So there are teams which are called community health teams that play a vital role in supporting people with complex health and care needs. So there might be a person who is a diabetic. That person will have complex needs compared to a person who doesn't have any illness. So there's a person who's old aged and who cannot walk, who's disabled. So that person will have different needs. That person will have more complex needs compared to anyone else who is able to do everything for themselves instead. So community health services would include urgent community response, including 2-hour rapid crisis response services. You have a district nurse there. You have child health services. You have community OT, which is occupational therapy, wheelchair services for assistance, and health visitors. So these all come under community health services. So sometimes people might visit a part of. And then there's some examples that we have to share with you of social welfare in Britain. So welfare benefits in the UK, they have 5 separate groups of services. So you have cash benefits, you have healthcare, you have education, you have housing, and you have personal social services. So these are 5 basic groups of services that you have, which come under the welfare benefits. So one of them most widely used is cash benefits, and these make around 10% of the GDP of the country, gross domestic product. This is the product that you develop within the country, within England, or within every country has their own GDP. So the category of cash benefits, this can be further broken down into 3 subgroups. One is national insurance, the other is means tested, and the third one is non-contributory benefits. So the NI system, the national insurance system, it's made up the greatest share of the social expenditure in the UK. While there are some non-contributory benefits that rank second, and means tested benefits are last. So there's a problem in the UK. So what that problem is, it's that it has been the low benefit level. So for example, pension benefits are less than half of a person's active salary. So when you get pension benefits, it's not that much. So you have benefits, but they're not as much as you would have when you're working actually. So healthcare is the second major part of UK's welfare system. It is organized through the NHS and it's financed by the taxes that we pay. The more the taxes we pay, the better is the health system. So the system is popular and it's relatively cost effective because we have certain medications that are free. The healthcare is free. And this is by the standards of other countries. compared to other countries. As it is universal, it covers the entire population, and it's, as I said, it's virtually free to people, apart from private care, obviously, but not many people go for private care because A, they don't need it, and B, it's too expensive, obviously. The system is popular and relatively cost effective. We've talked about that. And then, okay, so as it is to people, and priority is given to those in dire need of medical assistance. But people who don't have who need non-emergency medical services, they must wait sometimes up to 1 year or 2 years. Any questions from here?
No, please.
Okay. Just a minute. I think there's some people who want to join. Wait just a minute. I think there's some people in the waiting area who have wanted to join. I'm not getting any. Just a minute. Sorry. Uh, I don't know. Just a minute. Just hold on a second. I'll just. Okay, I'm sorry. Yeah, there's Matilda also who's trying to join in. Um, I'm not sure why she's not. Did you have a problem while joining? I just saw you just promptly joining. I didn't. I don't know. Anyways. Uh, yeah, we just proceed with the meeting. And when she joins, she can see the recording. Yeah, so where were we? So we were here. Okay, so education is one also very important aspect of social care provision. So when we talk about education, it is available to all school children through the ages of 5 to 16. Yet as children reach the age of 16, there are very fewer lower class children move on to further their education and move instead, they directly get into workforce. So there are very less people who continue their education. So in short, the system of higher education does not reflect a class bias. It's the responsibility for the British education system that lies within the central government, local government, and other professional interests. So all three have part in public school system. The central government provides for a legislative framework for the school. So while there are local governments that generally focus on organization of the schools and their professional interests that tend to influence the curriculum and testing procedures. So the different testing procedures you're aware of, and the different curriculum designing processes also that you're aware of that have an influence on education. Public housing, it consists mainly of council-owned rented houses. So obviously, they're not private houses. And they're also there to support you if you need support. Okay. So, uh, so that's it for it. And then public housing we've talked about. Then there are council houses also. So they're controlled by the local government, and usually they're provided by applying a means test. So there's a test that you have to go through, and if the council assesses you and if they consider you eligible, they would definitely provide you with housing services. This is for all those who require housing services. Okay, so in most other Western countries, there are aging populations that, which are one of the biggest challenges. So people are living for longer durations. And one of the biggest challenges for welfare state in the UK, the government is in the UK is facing a growing elderly population. So there are many people who are young, and the government in the UK is faced with a growing elderly population requiring more assistance and services. Yet the demographic problems are not as pronounced as in some other European countries. So there's another very important issue that affects social policy. So it is the level of unemployment. It's risen very high. So people, they're not working, or they're trying to work, but they're not getting into proper employments, or they're working a lot and they're not getting proper salaries. That is why they're not interested in working and just getting social benefits. So it's increased from the 1980s, but it has in 1990s. So reason that you think there is for unemployment? Oriola, any other reason that you think is there is for unemployment in the UK particularly I'm speaking about? Okay. So the main reasons I believe, and according to research also, for unemployment are obviously the one that I've just mentioned to you, that it's something to do with not having proper salaries. So if you don't have proper salary, what's there to be obviously if you're unemployed, well, there's no reason for obviously if you're employed and you're obviously not having the salary that's enough for you, there's no reason for you to work. Obviously, if you have better benefits, you would not want to work. You would instead want to have social services which are there for everyone. So at times it becomes very, very hard for people to understand that employment is very important, but then there's some um, like there's sometimes you have the elections and there are people who come and promise that they're going to be several jobs available, but then the number of jobs are also limited, and then now we have a lot of downsizing also happening. So there are many people who there are many people who have lost their jobs, or they have lost their working hours just because there's not enough salary for people. And then the Conservative Party responded to these challenges by promoting job training. So this is how you help people, especially to younger people. And the reason was that unemployment occurred mostly among uh, untrained manual worker employees. There's some key milestones in community health services policies. So uh, for instance, in 1948, there were community health services that were responsible for public health arm of of local authorities. And then in the year 1962, so remember you had there was one objective where you had to um, write these milestones, and you had to have an understanding of these milestones. Um, and in 1962, there was a hospital plan that emphasized the need to expand services in the community. 1963, there were health and welfare highlights that showed wide variation in local authority community service provision. Then you had the Gilly report that emphasized the importance of general practitioners that are being supported by a wider primary care team, and the need for closer integration between GPs and other services. So the GPs and other services were not integrated earlier. So then they were later on, when they're integrated, it becomes easier for them to work together. Okay. So in 1965, then there was a report of CBOM community, a committee, sorry, that calls for a better coordination between social care and other health and welfare services in the community. And in 1974, there was a responsibility for community health services that were transferred to the NHS in order to tackle poor coordination between community and hospital services. I hope these key milestones are clear. They just show you how healthcare has grown since the beginning. Okay. So then we show a timeline. So in 1987, again, this timeline is from the um, a continuation from 1974. So in 1987, there was promotion of better health proposes that or so I just want to ask you a question, Oriola. this timeline is very important in terms of understanding what happened in different stages. So sometimes we consider timelines, oh, that's just like we'll have to remember the dates. No, but you have to understand the important milestones in healthcare or whatever course you're doing. If you don't know the milestones, that what happened and what different things happened in different years, it becomes very hard for you to have an understanding of the different changes that happened in healthcare or whatever subject that you were studying. So in 1989, there was publication of Working for Patients Community Services, increasingly established between themselves as standalone NHS community trusts. And in 1997, you had the new NHS that was modern. You could depend upon the NHS because you had all these previous reports from 1948 up till 1989 that focused on health, that focused on communities that had services, but they're fragmented. So you had an all new modern NHS. There were and most community primary care trusts. In 2000, you had the NHS plan. So that plan was there for investment, a plan for reforming that proposes redesigning primary and community services, creating 500 new one-stop primary care centers. So there was large investment in it and in the intermediate care. The option to form care trusts was introduced, but relatively few are set up. In the year 2006, Our Health, Our Care, Our Say sets out a wide-reaching strategy. This was to shift care out of hospitals and to expand community provision, including by shifting resources. A variety of measures were introduced to promote integration, improve access, and strengthen prevention. In 2008, there were high quality care for all NHS this was the next NHS stage review, which recommended a separation of the primary care trusts commissioners, and they provided functions, and PCTs were directed to consider a range of organizational models for community services. So they started focusing more on the communities. So the NHS had next stage review. So our vision for primary and community care encourages greater pooling of resources by these primary care trusts. So, and the local authorities. And then there was development of new tariffs to encourage more provision of healthcare in the community. And then in 2009, you had transforming community services, which enabled new patterns of provisions and provision of healthcare. So there were different ways in which healthcare was being experimented. And then they also wanted to develop a strategy for community services and to identify future organizational models, separating their commissioning and provider functions. In 2012, now these ones are very important. The ones before were important, but these are also extremely important to remember and to understand. So you had the Health and Social Care Act. This was to transfer responsibility for commissioning community care health services from primary care trusts to newly formed CCGs. So these are community care providers. Some services, for example, the public health and health visiting are transferred to local authorities. So public health was not a main, it was not owned by the central government. It was transferred to local, so it was delegated to local authorities. In 2014, you had the NHS 5-year forward view that sets out a vision of how NHS services need to change. So there have been various changes from the very beginning. So there was more investment from acute care to primary and community care services, and this outlined several new care models. In 2015, NH organizations were directed to come together with local partners in order to develop some sustainability and transformation plans, which are called STPs, 5-year plans for health and care services in the area. In 2016, there were 44 sustainability and transformation plans. All of these proposals were there to redesign primary care and community services. It is often expected that this will reduce demand for hospital care. So we need less of hospital care. Is that all clear, Oriola? I can see a lot of more people join. Hello. Hello, everyone.
Yes.
Hello.
Good morning, Sandra, Matilda,
Good morning.
Good
Esperance.
morning.
Hello.
Good
Hi.
morning.
Is everyone okay?
Yes,
Yeah,
yes.
Oriola,
You're
this is a
fine.
bit okay. So
Yeah,
all of you
fine.
will get these recordings, so don't worry. And because I've been with you, good morning. Is everyone okay? I'm sorry if you had to
We're not English. Yeah. Let me sit down. Miss.
so I'll just pause this recording for a while.